Welcome to this educational program regarding ependymoma and the activities of CERN. It's important to understand the symptoms of ependymoma and the steps necessary in diagnosis. Dr. Kajar, would you begin this discussion?
Thank you, Terry. So the symptoms in ependymoma really depend on where the tumor occurs. And as we've discussed, tumor occurs in 3 different locations: in the spinal cord, at the back of the head of the posterior fossa, and in the big part of the brain, of the supratentorial brain. And I'm going to limit my comments of the symptoms in children because that's primarily what I see, and I have Dr. Gilbert address the adult symptomatology. So in children, the most commonest location of the tumor is in the cerebellum of the posterior fossa. The brain is in the head, which is like a fixed box. So whenever there's a tumor which grows within that fixed space, there's no room for expansion, versus a tumor in the abdomen where the tumor can grow quite large before it gets diagnosed. Once the space in that box on the head starts getting tight, children start having symptoms. And the most common symptoms in the younger age group are vomiting. They cannot complain about headaches, but occasionally an older child may complain of a headache. Older child may complain of a blurry vision, difficulty in school. Sometimes there'll be symptoms where the eyes start turning in, and that's because of the electrical connections from the spinal cord and the brain to the different muscles of the eye, which get affected because of the location of the tumor. In younger children, if they've reached milestones, which according to normal development, they'll start regressing with their milestones, which is a very common observation in the pediatric population, that a mother will observe that he was walking, getting up and crawling and cruising with the furniture, and now he can barely get up. I think those are important clues to the pediatrician or the primary caregiver that there's something seriously wrong with the child. Commonly, when the children start vomiting, every child cannot get a scan, but typically when the child keeps on coming in for the 3rd or 4th time to the pediatrician's office and saying the child is vomiting, I think that should be a definite clue that this child needs to have some additional medical attention. Mark, do you want to address some of the adult symptomatology?
Sure. Thank you, Amar. And I think a lot of the same principles apply in adults, although they tend to be more communicative. And you brought up the issues about headaches, and in the adult population, certainly, when the tumor is in the brain, again, supratentorial cerebrum, most common location of a brain ependymoma, they will often complain of headache. But oftentimes, depending upon the location of the tumor, we may see other, what we call focal neurologic signs, weakness or loss of sensation, maybe some incoordination. And if it is in what we call the dominant hemisphere, in right-handed people, that's the left side of the brain, we may even see things like language problems, difficulty finding words, difficulty understanding language. And that's a clue that there's something going on within the brain, and actually helps the neurologist localize the area. And those are non-specific, and so there are lots of things that can cause that. Certainly, ependymoma is one of them, but there are other brain tumors that are more common. Strokes can do the same thing, and part of the clues in diagnosis is how long it's taken to evolve. Obviously, strokes happen quite quickly. Tumors tend to evolve slowly. We also have the issue that some patients present with seizures, and that becomes a very, very apparent. You have a seizure, you know something is going on in the brain, and that usually warrants an image study. Typically, we now do magnetic resonance imaging, or MRI, to get a very good anatomical view of the brain, and can readily diagnose a tumor. But again, not know what type of tumor it is just on the MRI, and that leads to further investigation. For the spinal cord tumors, the symptomatology is quite different. The most common symptom patients present with is pain. Unfortunately, back pain is quite common. It's probably the most common neurologic complaint in the adult population in the United States. So how do you distinguish pain from tumor, which is rare, from pain from all different other spine problems, arthritis, degenerative changes, all of those things? And it is, in fact, quite difficult. But we would often say that if a pain persists, if the pain continues to worsen, that should warrant evaluation, because the treating physicians want to know if there's a tumor, but more commonly if there's a disc problem, something that warrants additional attention other than observation and some pain medication. If patients develop other neurologic symptoms, weakness in their extremities. If it's in the mid part of the spine, called the thoracic spine, you'd expect lower extremity weakness. If it's in the low part of the spine, in the lumbar region, you'd expect lower extremity weakness. If it's up in the high part of the spine, the cervical region, you may have both lower and upper extremity weakness. Those would be clues. Since ependymomas develop within the spinal cord itself, oftentimes patients will notice problems with controlling bowel or bladder function early on, and that's another clue, as you would not tend to see that with the more common spine problems. This would actually tell you it's a spinal cord problem. So I think there are clues, and depending upon the symptoms that patients present with, we're not often fooled if there's a true spinal cord problem. And it takes us right to the diagnostic testing. The initial testing would be magnetic resonance imaging of the spine, which then leads to the next step. And I think both in adult and pediatric patients who have tumors, the next step is to consult our neurosurgical colleagues to get a piece of that tissue so that our colleagues, like Ken, can look at it under the microscope and make a diagnosis. In our case, if it's an ependymoma, that brings into play all of the subsequent treatments. And one of the important consultations with a neurosurgeon is whether they should just remove a small piece for diagnosis or actually attempt to move the bulk of the tumor or hopefully actually all visible tumor.
I think the other part of Terry's question was the diagnostic workup, and you alluded to that while you were discussing the adult symptomatology. I think in today's day and age, as Mark mentioned, the key part, initial part of the diagnostic workup is getting a very good quality magnetic resonance imaging scan or MRI scan. And that includes imaging of the brain and imaging of the spinal cord with and without contrast. And I think it's very important that we do a proper imaging of the spinal cord for two reasons. Number one, to make a diagnosis. Number two, to see whether there's metastatic disease and whether there's tumor spread, even if the tumor were located in the back of the head. And I think going down and imaging the complete cord, make sure that there's no tiny bit of metastatic tumor, which is at the end of the cord. These are fine-tuned points that certain centers are used to doing and bring a certain amount of quality to the imaging. So not every MRI is an MRI, there are differences in qualities. For the head MRI, I think the key feature that we're looking for is helping the surgeon decide the surgical technique, the extent of surgery. And I think from a parent perspective, what is crucial about that head MRI when the surgeon goes to discuss the operation is predicting what the post-op complications are going to be. So this tumor, which is located at the back of the head, is very intricately involved with all the cranial nerves which supply vital functions in our, to the eyes, as I mentioned, swallowing, tongue, breathing. And many a times the surgeon can go in and predict to the family, listen, we're going to be able to get this tumor out, but the child is going to have a little difficulty. And I think that really helps the family sort of understand that when a child comes back out of surgery, that there's going to be, and it helps them sort of not get anxious when the child is ill. There's a typical finding on a head MRI where you have the tumor extruding from the posterior fossa to the upper part of the cervical cord, which we call as a toothpaste sign, which is very typical of an ependymoma. So that also tips off the surgeon and also tips off the family members and the caregivers that this is 99% an ependymoma. And if they're dissecting an ependymoma, this is going to be a 6, 7, 8 hour surgery. And I think it again prepares the family and prepares the caregivers as to what to expect post-op. So I think that completes the diagnostic workup. Occasionally we do some special scanning, trying to see which parts of the fibers are involved in the spinal cord, if they're going to go after spinal cord tumor, and how aggressive you get with the surgery, as Mark mentioned. But the key thing is to get adequate tissue to hand it off to the biologist and the neuropathologist, so we start getting a proper diagnosis and then fine-tuning therapy.
And I would add that sometimes we do need to actually sample the spinal fluid to look for tumor cells if we're concerned that they may have spread, if we don't see them on the imaging of the spine.
I think a really important point that both Mark and Amar brought out is that unlike other brain tumors, this is truly still a surgical disease in terms of therapy. It's really important that the bulk of the disease is completely removed, and the expertise of the neurosurgeon is really crucial with that. And so, some of the centers that we have in CERN would allow us to help to do that.
It's Great introduction to the diagnosis and understanding the symptoms of these tumors. In the next section, we'll talk a little bit more about surgery and treatment. Thank you all.